12 hours in complete darkness. Only a dying flashlight between her and total blindness. Nurse Sarah Williams had 17 wounded soldiers depending on her surgical skills, and the generators weren't coming back online until dawn. The crisis began at 2:47 a.m. on March 15, 1968, during the height of the Tet Offensive. Firebase Charlie, a remote medical outpost 30 miles northwest of Saigon, served as a critical treatment facility for casualties from the surrounding combat zones. The base housed a modest field hospital equipped with basic surgical equipment and staffed by a skeleton crew of medical personnel who worked around the clock to save lives. Sarah Williams had arrived at Firebase Charlie 3 months earlier as part of the Army Nurse Corps deployment to Vietnam. At 23 years old, she possessed impressive medical credentials from Johns Hopkins School of Nursing, but her battlefield experience remained limited to the controlled chaos of emergency room rotations during her training. Which city in the world are you watching this video from today? If you liked this story about those who serve in silence, please subscribe and support us for more stories. The assignment to Firebase Charlie represented Sarah's first exposure to combat medicine under actual wartime conditions. The facility treated everything from routine illnesses to severe battle injuries, requiring medical staff to adapt quickly to situations that rarely appeared in textbooks or training scenarios. March had brought unusually heavy fighting to the region as North Vietnamese forces launched coordinated attacks against American positions throughout the area. The Firebase medical team found themselves overwhelmed with casualties as helicopters arrived hourly with wounded soldiers requiring immediate treatment. Sarah's responsibilities included triage assessment, wound care, medication administration, and assisting with surgical procedures when additional hands were needed. Her supervisor, Major Patricia Collins, had praised Sarah's quick learning and steady performance under pressure during their brief time working together. The evening of March 14th had proceeded normally despite the increased patient load. Sarah completed her rounds, checked medication supplies, and prepared equipment for the next day's anticipated surgeries. Weather reports indicated approaching thunderstorms, but the base's backup generators provided confidence that medical operations could continue uninterrupted. The first indication of trouble came at 2:30 a.m., when lightning strikes began hitting the area with unusual frequency and intensity. The main power grid fluctuated several times before stabilizing, causing momentary disruptions to the hospital's electrical systems without creating immediate concern among the medical staff. Sarah was reviewing patient charts in the nurse's station when the catastrophic power failure occurred. A massive lightning strike hit the base's main electrical transformer, creating a surge that overwhelmed the primary power systems and triggered automatic shutdowns designed to protect sensitive medical equipment. The backup generators, which should have activated within seconds, failed to engage due to water damage from torrential rain that had flooded the generator housing. Emergency lighting systems provided illumination for approximately 15 minutes before their battery reserves were exhausted, leaving the entire medical facility in complete darkness. The timing of the power failure created a perfect storm of medical emergencies. 17 critically wounded soldiers occupied beds in various stages of treatment when the lights went out. Several patients required continuous monitoring and immediate medical intervention that couldn't wait for power restoration. Major Collins attempted to coordinate emergency response efforts, but communication systems had failed along with the electrical grid. Radio equipment remained non-functional, and telephone lines had been damaged by the same storm that knocked out power. The medical team was effectively isolated until dawn when repair crews could assess and address the widespread damage. Sarah found herself responsible for the most critical patients when the emergency lighting failed. Armed with only a standard military flashlight and basic medical supplies, she faced medical challenges that would have been difficult under optimal conditions. The wounded soldiers in her care included victims of mortar attacks, gunshot wounds, and explosive device injuries requiring immediate surgical intervention. The first patient, Private Martinez, suffered from severe abdominal trauma caused by shrapnel from a rocket-propelled grenade. His condition had stabilized temporarily, but internal bleeding required surgical exploration that couldn't be delayed without fatal consequences. The procedure would normally be performed in a fully equipped operating theater with bright surgical lighting and sterile conditions. Private Johnson presented with a compound fracture of his left femur caused by a sniper's bullet. The injury had damaged major blood vessels, creating ongoing bleeding that required immediate vascular repair. Bone fragments needed removal, and the fracture required stabilization to prevent permanent disability or amputation. Sergeant Thompson had sustained burns over 30% of his body from a fuel explosion during a convoy attack. His injuries required constant monitoring for signs of infection, fluid replacement therapy, and specialized wound care that demanded precise attention to detail impossible to achieve in darkness. The remaining 14 patients suffered from various degrees of trauma, ranging from minor shrapnel wounds to severe head injuries. Each case required individual assessment and treatment that would challenge even experienced surgeons under normal circumstances. Sarah's nursing background provided essential skills, but she lacked surgical training for the complex procedures these injuries demanded. Working by flashlight created additional complications beyond simple visibility issues. The narrow beam of light made it impossible to maintain the broad field of vision necessary for complex medical procedures. Sarah had to constantly reposition the flashlight while attempting to perform delicate tasks that required both hands. Sterilization procedures became nearly impossible without proper lighting and electrical equipment. Sarah improvised sterilization techniques using alcohol solutions and flame sterilization when possible, but maintaining aseptic conditions proved extremely challenging under field conditions in complete darkness. The psychological impact on both patients and medical staff added another layer of complexity to an already desperate situation. Wounded soldiers who were already traumatized by combat injuries now faced the terror of receiving medical treatment in complete darkness. Their fear and confusion made patient cooperation difficult and increased the risk of complications during procedures. Sarah's first surgical challenge involved Private Martinez's abdominal exploration. Using her flashlight to illuminate the operative field, she began the delicate process of locating and controlling internal bleeding. The narrow beam of light made it impossible to see the entire surgical area simultaneously, requiring her to work by feel as much as by sight. The procedure required Sarah to identify damaged blood vessels while avoiding injury to healthy tissue and organs. Her nursing training had included observation of surgical procedures, but she had never performed major surgery independently. The combination of darkness, limited equipment, and lack of surgical experience created circumstances that would challenge even veteran combat surgeons. Working methodically despite the adverse conditions, Sarah managed to locate the primary source of bleeding and apply pressure while preparing suture materials. The flashlight beam provided barely adequate illumination for threading needles and tying surgical knots, but her steady hands and determination enabled her to continue despite the nearly impossible conditions. The suturing process took nearly 3 hours under conditions that would normally require 30 minutes in a properly equipped operating room. Sarah's flashlight batteries began to weaken during the procedure, dimming the already inadequate illumination and forcing her to work even more carefully to avoid surgical errors. Private Martinez's surgery concluded successfully just as the flashlight beam became too dim for detailed work. Sarah had managed to control the internal bleeding and close the surgical incision, but the patient required careful monitoring throughout the remainder of the night to ensure that complications didn't develop. The second major challenge involved Sergeant Thompson's burn treatment. Managing extensive burns requires precise assessment of wound depths, careful cleaning to prevent infection, and application of specialized dressings that promote healing while preventing complications. These procedures normally require bright lighting and sterile conditions that were impossible to achieve in the current circumstances. Sarah improvised burn treatment using available supplies and techniques adapted from her training. She cleaned the wounds as thoroughly as possible using sterile saline solutions, applied antibiotic ointments to prevent infection, and covered the injuries with clean bandages that would need frequent changing throughout the night. The psychological challenges of treating burn patients in darkness proved as difficult as the medical aspects. Sergeant Thompson experienced severe pain that required careful medication management, but determining appropriate dosages without proper lighting and monitoring equipment required Sarah to rely on clinical judgment and patient observation skills developed through experience. Private Johnson's vascular repair presented the most technically demanding challenge of the night. Repairing damaged blood vessels requires microsurgical precision that is difficult to achieve even under optimal conditions. Attempting such procedures by flashlight seemed impossible, but the alternative was allowing the patient to bleed to death. Sarah approached the vascular repair systematically, using her flashlight to identify the damaged vessels while applying pressure to control bleeding. The procedure required her to isolate the injured blood vessel, remove damaged tissue, and create a surgical connection that would restore normal blood flow. The narrow beam of flashlight illumination made it nearly impossible to see the fine detail necessary for vascular surgery. Sarah had to work largely by feel, using her fingers to guide surgical instruments while trying to maintain visual control of the operative field. The technique required extraordinary concentration and steady hands despite the stress of operating under such adverse conditions. The vascular repair consumed 4 hours of painstaking work as Sarah's flashlight batteries continued to weaken. She managed to restore blood flow to Private Johnson's leg, but the procedure had pushed her improvised lighting to its absolute limits. The flashlight beam was now so dim that detailed surgical work was no longer possible. The remaining patients required less complex but equally important medical care throughout the night. Sarah moved from bed to bed, checking vital signs by touch, administering medications by carefully measured doses, and providing comfort to soldiers who were terrified by their injuries and the darkness surrounding them. Monitoring patient conditions without electronic equipment required Sarah to rely on fundamental clinical skills that predated modern medical technology. She assessed breathing by listening and feeling for chest movement, checked pulses by palpation, and evaluated mental status through verbal interaction with conscious patients. Medication administration in darkness presented significant challenges in ensuring accurate dosages and preventing drug errors. Sarah had memorized the locations of essential medications and used careful measuring techniques to ensure that patients received appropriate treatments despite the inability to read labels or see measurement markings clearly. The psychological aspect of patient care became increasingly important as the night progressed. Wounded soldiers who were already suffering from combat trauma found the darkness and uncertain medical situation deeply disturbing. Sarah spent considerable time providing reassurance and emotional support while continuing to address their medical needs. Communication with patients required Sarah to maintain calm, confident vocal tones that projected competence and control despite the desperate circumstances. She explained each procedure before performing it, warned patients about discomfort they might experience, and provided continuous updates about their condition and treatment progress. The hours between 4 a.m. and dawn represented the most challenging period of the ordeal. Sarah's flashlight had become too dim for any detailed work, forcing her to rely entirely on touch and sound for patient assessment. Several patients developed complications that required immediate attention despite the lack of adequate lighting. Private Wilson, who had initially appeared stable, began showing signs of shock that required immediate fluid replacement therapy. Sarah had to establish intravenous access and monitor fluid administration by feel alone, using her clinical experience to assess the patient's response to treatment. Corporal Davis experienced respiratory distress that suggested developing pneumonia, a common complication in chest injury patients. Without X-ray equipment or proper lighting for physical examination, Sarah had to diagnose and treat the condition based on subtle changes in breathing patterns and chest sounds that she detected through careful listening. The final hours before dawn tested Sarah's physical and emotional endurance to their limits. She had been working continuously for over 10 hours under conditions that would exhaust even well-rested medical personnel. Her hands were cramped from holding the flashlight, her back ached from bending over patients, and her eyes strained from trying to see in inadequate light. Despite the physical exhaustion, Sarah continued moving between patients, checking their conditions, adjusting treatments, and providing the emotional support that kept morale from collapsing entirely. Her determination and competence had become the foundation that held the entire medical situation together during the crisis. The first signs of dawn appeared at approximately 6:15 a.m., bringing enough natural light to allow Sarah to properly assess her patient's conditions for the first time since the power failure. The visual confirmation of her night's work revealed the extent of her accomplishments under nearly impossible circumstances. All 17 patients had survived the night, despite the lack of proper lighting equipment and surgical facilities. The three most critically injured soldiers showed stable vital signs and appeared to be recovering from their emergency treatments. Sarah's improvised surgical procedures had been successful in controlling bleeding and preventing life-threatening complications. The arrival of repair crews at dawn brought the first outside contact since the power failure began. Communications were restored within an hour, allowing requests for medical evacuation helicopters and additional surgical support for patients requiring complex procedures that exceeded the capabilities of the field hospital. Major Collins, who had been coordinating recovery efforts throughout the night, expressed amazement at Sarah's accomplishments during the power outage. The successful treatment of 17 critical patients under such adverse conditions exceeded anything in her previous experience with combat medicine. The medical evacuation of the most seriously injured patients proceeded smoothly once helicopter transport became available. Private Martinez, Sergeant Thompson, and Private Johnson were transferred to fully equipped hospitals in Saigon, where they received definitive surgical care and continued their recovery. The psychological impact of the night's events affected both patients and medical staff in ways that became apparent only after the immediate crisis had passed. Sarah experienced delayed stress reactions that were common among medical personnel who had worked under extreme conditions for extended periods. Professional recognition for Sarah's performance during the power outage came through official channels within days of the incident. Her actions had prevented multiple deaths and demonstrated exceptional skill under conditions that would have challenged even veteran surgeons with years of combat experience. The Army Nurse Corps used Sarah's experience as a case study for training programs that prepared medical personnel for emergency situations where standard procedures and equipment were unavailable. Her techniques for improvising surgical procedures under adverse conditions became part of the curriculum for combat medics. Years later, medical historians would recognize the night of March 15, 1968, as an extraordinary example of battlefield medicine performed under the most challenging circumstances of the Vietnam War. Sarah's 12 hours of surgery by flashlight saved 17 lives and demonstrated the importance of medical training that emphasized fundamental skills over dependence on technology. The soldiers Sarah treated during that long night remained grateful throughout their lives for her skill and determination. Several maintained contact with her after the war, crediting her with not only saving their lives, but providing the emotional strength that helped them survive their darkest hours. Private Martinez recovered completely from his abdominal injuries and returned to civilian life as a successful businessman. He often spoke about the young nurse whose steady hands and calm voice had guided him through the worst night of his life, operating by nothing more than flashlight while explosions echoed in the distance. Sergeant Thompson's burn injuries healed with minimal scarring, thanks to Sarah's careful treatment during those critical first hours. His recovery exceeded medical expectations, and he attributed his successful healing to the immediate care he received during the power outage when proper treatment seemed impossible. Private Johnson retained full use of his leg despite the severity of his vascular injuries. The surgical repair Sarah performed by flashlight had restored blood flow so effectively that he experienced no long-term complications from what could have been a career-ending or life-threatening injury. Sarah Williams returned to civilian nursing after completing her tour in Vietnam, but her experience during the power outage influenced her entire subsequent career. She specialized in emergency medicine and became an advocate for training programs that emphasized fundamental clinical skills alongside advanced medical technology. The flashlight that provided the only illumination during those 12 crucial hours was preserved as a symbol of resourcefulness and determination under impossible circumstances. Sarah kept it throughout her life as a reminder that the most important medical tools were knowledge, skill, and the willingness to act when others needed help. The field hospital at Firebase Charlie was eventually upgraded with improved emergency power systems and backup lighting that would prevent similar situations in the future. However, the lessons learned during that night of darkness continued to influence combat medical training for decades afterward. Medical personnel throughout the military studied Sarah's techniques for performing complex procedures under adverse conditions. Her experience demonstrated that proper training and determination could overcome seemingly impossible obstacles when lives depended on medical intervention. The story of the 12-hour surgery by flashlight became legendary within military medical circles, representing the highest ideals of combat medicine, where personnel risked everything to save wounded soldiers regardless of conditions or personal safety. Nurse Sarah Williams had proven that heroism in combat medicine didn't always involve dramatic rescues or obvious acts of bravery. Sometimes it meant working quietly through the night with nothing but a dying flashlight, using skill and determination to save lives when conventional medicine had failed. Her example inspired generations of military medical personnel who understood that their most important qualification wasn't access to advanced equipment or perfect conditions, but rather the willingness to do whatever was necessary to save lives when soldiers depended on their expertise. The 17 soldiers who survived that night, because of Sarah's skill, represented more than individual lives saved. They returned to their families, pursued careers, raised children, and contributed to society in ways that multiplied the impact of her 12 hours of surgery by flashlight. In the darkness of Firebase Charlie, with only a dying flashlight for illumination, Sarah Williams had demonstrated that the most advanced medical technology was still the trained human mind, applied with courage and determination to save lives when everything else had failed.